Hello everyone, this is Mustafa Murayati, a fourth-year medical student at Baghdad College of Medicine. In this series of lectures, I'm going to talk about the arterial supply of the brain, and especially we will discuss the supratentorial arteries, the arteries above the tentorium cerebelli. In this first part, the content of this presentation will to take a general overview on the supratentorial arteries, their origin and distribution. Regarding the vascular supply of the brain, you must have heard of this term, the circle of Willis. Well, this is, as you can see here, this is the circle. It's termed as circle of Willis. It's at the base of the brain, at the inferior surface of the brain, and it's a vascular structure. Here, the green outline represents the circle. Well, let's see what it consists of. The circle of Willis consists of two internal carotid arteries that contribute to form the two middle cerebral arteries, which are the lateral branches coming off the internal carotid artery. And also we have an anterior cerebral arteries, also coming from the internal carotid artery. So the terminal bifurcation of the internal carotid artery, including the MCA, laterally to supply the lateral surface of the brain, and the ACA, which goes medially and anteriorly to supply the anterior and medial surface of the brain. And the two ACAs are joined by the anterior communicating artery. That's termed as the anterior part or the anterior circulation. Regarding the posterior circulation, we have the basilar artery that will give rise to the two posterior cerebral arteries. Now, the basilar and the two posterior cerebral arteries are termed as the posterior circulation. The two circulations, the anterior and the posterior one, are joined by the posterior communicating artery, which is a branch from the ICA that goes posteriorly to be joined by the PCA to contribute to the posterior circulation. This is the circle of Willis in situ at the base of the brain at the inferior surface. As you can see here, this is the right hemisphere and this is the left hemisphere. So the circle of Willis, here we have the right ICA and here is the left ICA, and the terminal branches are bifurcation of the ICA into the MCA, which goes laterally, as you can see here. Here we have removed the anterior part of the right temporal lobe to show the course of the MCA into this fissure between the frontoparietal lobe and the temporal lobe inferiorly. This is termed as the Sylvian fissure. As you can see here, is on the left side going through the Sylvian fissure to pass to the lateral surface of the brain to be supplied by the MCA. And then we have the ACA, which goes medially and anteriorly to supply the anterior and medial surface of the brain. And the two ACAs are joined by the anterior communicating artery. Regarding the posterior circulation, we have the two vertebral arteries come to join in front of the pons to form the basilar artery, which contribute to the posterior cerebral arteries. And the PCAs are joined by the posterior communicating artery, which is a branch from the ICA. As we are talking anatomically, the origin of these arteries that supply the brain is from the heart. So let's track them from the aortic arch. We have on the right side, there's a brachiocephalic trunk that is on the right side, and we have two subclavian arteries. The right subclavian artery arises from the brachiocephalic trunk, while the left one arises from the aortic arch. And we have two common carotid arteries. The right one, just as for the right subclavian artery, arises from the brachiocephalic trunk, while the left one arises from the aortic arch. The common carotid artery bifurcates at the level of C3-C4 vertebral level into the internal carotid artery, which runs deep inside the skull to supply the brain and the eye, and that will contribute to the circle of Willis, the anterior part, and we have the external carotid artery, which runs outside the skull to supply the head and neck structures. And as we mentioned, the ICA will form the anterior part of circle of Willis, including the middle cerebral arteries, which goes laterally, and the anterior cerebral arteries, which goes anteriorly. And regarding the posterior circulation, we have the two vertebral arteries comes from the two subclavian arteries and unite to form the basilar artery, which contribute to the posterior cerebral artery regarding the posterior circulation. And here we conclude the first part of this series.